Hi, my name's Kate Freeman. Let me introduce you to Bug, a brand new platform. Bug is a client support system which assists dietitians in improving client eating behaviours for long-term healthy aging. It does this by providing ongoing, individualised support based on reliable daily eating habits, accessible anywhere, anytime by dietitian, client and carer. The proportion of adults aged 65 years and over is being predicted to rapidly increase by 2050. We know that increasing age is a major risk factor for developing chronic diseases such as heart disease, diabetes and some cancers. This means that older Australians will spend a large proportion of their time unwell and battling sickness. The evidence is very clear that healthy eating and lifestyle habits are the biggest ways that we prevent and decrease our risk of developing chronic disease later on in life. Who are the people and the experts that help us improve our eating habits over time? Nutritionists and dietitians. Bug aims to help those very people. Meet Joe and Betty. They've come for their first appointment with dietitians Kate and Claire. They need some help with their eating from day to day to improve their health in their elderly years. The first appointment takes 1 hour. Unfortunately, the first 45 minutes is spent gaining an idea of their dietary and lifestyle history. This involves very thorough and complicated questionnaires to gain a really good picture of what they're eating day to day. We need this information in order to give valuable and practical advice back to the client. If we don't understand what their current eating habits look like, we're not able to provide advice on how they can make positive changes to improve their health. So after 45 minutes of very complicated questionnaires, we now only have 15 minutes to give advice back. Our clients are already recording their food and drink intake day to day using various apps available on iPhone and Android systems. Unfortunately, this data is completely useless to nutritionists and dietitians. We are proposing to solve these problems by removing all need for manual food diaries with pen and paper, existing incompatible apps and nutrient analysis software, with an entire new system that takes care of the whole process from beginning to end. The program will involve an application where clients can input their food data day to day. This data will then update in real time a practitioner portal where practitioners can check in day to day or as often as they need to see how their clients are tracking with the advice that was given. There is no need for the client to check back in with the practitioner regularly, saving valuable time and money. The program will be extremely reliable and cloud-based, which means that all data can be pushed to any kind of device, anywhere, anytime, and accessed by both practitioners, clients, and their carers. This means that in the case of an elderly person, like Joe and Betty, that if their diet is falling below par and their carer notices a dip, the practitioner can be notified and intervention can be done. This program will also be built to sync with current programs already out, particularly in aged care facilities and residential care facilities. What's this mean from a business perspective? We know that there are 1,500 practitioners currently in Australia and New Zealand. Based on what we know about those practitioners, if we are able to capture even just 10% of this market, we're looking at a potential revenue of $270,000 per year on a subscription-based service to this product.